Okay, thank you, colleagues. Thank you, friends, for being here. And let me welcome our audience to the first virtual event organized by the Committee for the Exercise of Inalienable Rights of the Palestinian People. My name is Sheikh Niang. I'm the representative of Senegal to the UN and chair of the committee. We live in very unprecedented times when the world is and the UN are facing the COVID-19 epidemic. And we are somewhat compelled to adapt our way of reaching our friends and supporters of the Palestinian cause via new technology. In fact, it is precisely in challenging times that we must rally our support in solidarity. For this reason, today's event is focused on Gaza, and we will have a conversation with Mr. Matthias Schmale, UNRWA Director of Operations in Gaza, on the following topic, the COVID-19 pandemic in Gaza and ways to mitigate its impact on Palestinian refugees. Before giving the floor to Mr. Schmale, 2 words about the Committee for Exercise of the Inalienable Rights of the Palestinian People. The committee was established by the UNRWA in 1975, and its mandate is renewed annually. The committee's work is aimed at promoting a just and peaceful settlement to the Israeli-Palestinian conflict and end to Israeli occupation. Realizing the two-state solution, Israel and Palestine living side by side in peace within secure and recognized borders, supporting the exercise of the inalienable rights of the Palestinian people, including self-determination, sovereignty, and right to return. Its mandate is carried out by raising awareness on the question of Palestine through events and conferences at headquarters and abroad, capacity building programs, and the annual observance of International Day of Solidarity with the Palestinian people on the 29th of November. I am today joined by several of my colleagues and members of the Bureau of the Committee. Namely, we have the Ambassador of Indonesia, of Afghanistan, of Cuba. If she's not there yet, I think she's supposed to be there. And Ambassador of Namibia. I don't know if I'm leaving someone else out. And we have also the permanent observer of the State of Palestine and his deputy, who are also among us today. Before we start, let me just remind everyone that this event is being webcast live on the Facebook page of the committee. This is an interactive event, so we encourage viewers from around the world to submit questions through the Facebook comment box in the live video stream. Everyone is also encouraged to tweet the hashtag Rights for Palestine. This event is being recorded and will later be posted on the webpage of the committee, as well as our social media channels like Facebook and YouTube. Let me now turn to Mr. Schmale. During his more than 24 years of professional experience in international humanitarian and development organizations, Mr. Schmale has held numerous senior management positions. For UNRWA, he has served as the director for Lebanon, for Syria, and for its representative office in New York. In October 2017, he was appointed as director of field operations in Gaza. Mr. Schmale, good afternoon to you. We'll give you the floor. After that, we'll have a Q&A session. So you have the floor, sir.
Thank you very much, Ambassador Sheikh Niang. It's a real honor to have been asked to participate in this event, and I thank you and your Bureau members for making this possible. Allow me also to extend greetings to Ambassador Mansour and his deputy. It was a pleasure getting to know you and work with you during my brief period in New York. And I think the idea for this event came originally from the Permanent Mission of Palestine. So thank you very much for that. And of course, thank you to Elio for having facilitated and set it up. Ambassador, if you allow me a few introductory remarks, and then, as you said, it should really be an interactive event. On a perhaps lighter note, although it's actually a serious one, when the corona crisis reached this region, including Gaza, a bit more than a month ago, you saw lots of comments on social media from here. There's a very active social media scene here, as many of you will know. the comments were welcoming the rest of the world to the experience of living in quarantine. Because for many Palestinians here, refugees and non-refugees alike, indeed.
Let me just remind everyone that this event is being
welcoming the rest of the world to the experience of living in quarantine. Okay, there's an echo there now, but let me continue. So it was indeed, the sense was, and still is among many Palestinians here, that they have lived in a kind of quarantine for the past 14 years. And, you know, so the serious point here is that hopefully, as dramatic as the corona crisis is for everyone around the world, one positive outcome could be that people have perhaps a better understanding of what it means to be locked off from the rest of the world and not being able to move basically outside of your home area. Then the second more general remark I want to make is that so far, 4 weeks into this, Gaza has been spared the worst. We have so far 13 cases, as many of you might know, but they are in quarantine installations. So there are people who've come into Gaza from trips overseas. It appears that so far there has been no local outbreak. So the virus has not been transmitted into local communities. And that's, of course, good news so far, if correct. We don't know this for sure because, of course, not everyone who's come back from trips has been tested. The testing capacity is rather limited. That's one of the asks of the authorities here to the international community, is help us make sure we have enough test kits so that we can really test all those that need to be tested as part of the containment strategy. The focus now is really on trying to prevent the virus from getting out of the quarantine installations into the local community, because in my mind there is no doubt that if the virus gets into the local communities here, including the refugee camps, it could potentially be a disaster that we have not seen before, with all the disasters we've seen in Gaza. What I'm told by the health experts is that for every 1,000 people, for every 100 people, sorry, that might get ill from COVID-19, you would need 5 that will have to have access to an intensive care unit bed. And I think you in New York, in some ways, in the epicenter of the crisis right now, know what it means. Now, in Gaza, there are maximum 85, 87 ICU beds, some of them, of course, currently occupied. So you can do the mathematics. As soon as more than 1,500, 2,000 people get ill, the hospitalization sector here simply will not be able to cope. And again, there is, of course, a link with the blockade. We have seen over these past few years that the 14 years of blockade have caused a lot of damage in Gaza, including weakening significantly the health capacities, the public health capacities. So we are all extremely worried about the virus reaching local communities, because it's very clear that the health sector will be unlikely in a position to really cope with that. My next comment to make is that I want to pay tribute to, first of all, President Abbas and the PA. I think it was a courageous step a month ago to declare a state of emergency. That was not always or not immediately welcomed here in Gaza, but it was, looking back, clearly the right step to take. And it did influence us, including in UNRWA. We immediately, a day or two later, then closed our schools. We run 276 schools here in Gaza that are populated by 282,000 children. So more than 10% of Gaza's 2 million population goes to UNRWA schools. And I think that was a major contribution to containing the virus. We immediately had 282,000 children at home. We, of course, the almost 9,000 UNRWA teaching staff similarly started working from home. So we set a signal by that action, and the schools here in the Gaza Strip, the non-UNRWA schools, the local authority schools and PA schools followed suit immediately. I also must say, and this may not be popular for everyone to hear, but the local authorities, or at least some key players in the local authorities, have done their bit as well. I think again, was a courageous step 2 weeks or so ago to close all mosques. You know, this close to Ramadan, to in a very deep a place with deeply held religious beliefs, to close mosques was not an easy decision. Similarly, to close restaurants and cafes was a good move. Similarly, the decision that all people coming into Gaza should go into quarantine for initially 2 weeks, and then it was extended to 3 weeks, was a courageous decision and right decision. So I think various actors, including the UN and the local authorities, have done the right thing and have contributed to so far containing the virus. To repeat, our big worry now is that we keep it this way. You know, I sometimes say this is a war against an unseen enemy, and having lost a couple of military escalations with a neighbor, one would only wish that Gaza wins this war against the unseen enemy. That requires the coronavirus that affects us all. That requires staying absolutely vigilant in terms of the quarantine centers. And I really think the authorities here, with the support of Ramallah and the UN system, are doing what they can. Now, they need to be supported. I have mentioned the test kits that are critical. They are, of course, beefing up the ICU capacity is another critical bit. Properly furnishing the quarantine centers that have been established is another one. Allow me then, finally, Ambassador, to say a few words about UNRWA. I've mentioned already that since a month or so ago, I said to our almost 13,000 staff, whether the virus is here or not, whether the blockade will keep it out or not, let's start acting as if it's here. And that's why we closed the school, also, as I said, under the impact of the state of emergency decision of President Abbas. That's why we then very quickly moved our 22 health centers that conduct 1 million primary healthcare consultations every quarter. We instituted a very strict triage system, meaning that people with respiratory illnesses and symptoms were directed to nearby schools that we reopened as health posts. So we wanted to protect, and so far that's worked very well, people with respiratory illnesses and symptoms from everyone else and vice versa. That was, I think, an important public health measure. We then also have concentrated on working from home. The colleagues who can, amongst our 13,000 staff, notably the teachers, are working from home since several weeks, and they're not sitting around. Sadly, Gaza has a lot of experience providing education in emergencies. So what our teachers are doing, like in all UNRWA fields, and so in Syria, Lebanon, and so on, the West Bank, including East Jerusalem, is conducting education work online. So materials are made available to the students, and teachers through online mechanisms as well as phone are trying to accompany parents and teachers through this difficult period. We are now ready also, if there were an outbreak, again, you know, we all hope it won't happen. If there were, we will immediately move our primary healthcare work to what we call telemedicine. Primary healthcare is essentially about providing advice, so that can be done online. We've got health teams that are ready to visit urgent cases at home, because of course the health teams can, if they get the right equipment, can protect themselves and can do the right things, visiting people, bring important medicine to them. For example, one critical group we all know is elderly people, and especially elderly people with previous illnesses like diabetes, non-communicable diseases. It's critical that essential health services to them will be provided. We are also ready, in order to relieve the public health system, for a time-limited period as an emergency measure, extend our essential primary health care services here to non-refugees, because that would then free up the public authorities to concentrate on the fight against corona. Very last remark is, all of this would not be possible in terms of what UNRWA is doing if we did not have our core programs. I've mentioned our 9,000 teachers, who, by the way, and the 282,000 children. are important agents in spreading key public health messages about washing your hands and so on. You all know the drill. When I started 2.5 years ago, our Chief of Education, Farid, told me, basically, we have an ambassador, UNRWA, in almost each home in Gaza, the children. And we have 90% of the phone numbers of all our children's parents. So there's an enormous reach we have, and we're also playing a role in public health messaging. This would not be possible if the member states, many of you had not invested for decades in building a successful development enterprise. And so our plea is, then let's not just focus on Corona, that's critical right now, but let's keep UNRWA going in its core services. We, as you know, have a continued funding crisis, and please help us also to provide essential emergency work like the food program to over 1 million people. Maybe I stop there, Ambassador, and hand it back to you. Thank you again for this opportunity.
Thank you, Director Schmale, for your very clear and insightful presentation of Gaza as impacted by COVID-19, and also for the depiction of the welcome, and for the depiction of the solutions being put forward by UNRWA. So I would like to thank you very much for your presentation. Now I would like to turn to the members of the Bureau. They want to ask questions. I think that I will give them the floor. Maybe we have to just be aware that we have time constraints, and if we have to make presentation, they must be as short as possible and just have very pinpoint questions, if possible. So you have the floor, colleagues. I don't know who want to speak among you first. I can see Jani. Jani, you have the floor, Ambassador of Indonesia.
Yeah, thank you so much, Sheikh, and dear colleagues. Nice to see you all healthy. Welcome again, Anna. Just quick point, actually, Director. Thank you very much, Matthias, for the expose. You know, we have always been in support of UNRWA as well as the Palestinian cause. So simply underlining that very important point. And with this week of the COVID, you mentioned that there are 14 cases thus far. And I hope there are measures that have been undertaken. Now, my question is quite simple. Noting that there are different level of density and quality of health facilities over the areas, not every area has the same density of people. Could you share the different challenges facing UNRWA, and what is your strategy in ensuring that all areas in the OPT are equally prepared and ready to address the spread of COVID-19? And also in line with this, has there been any efforts by the colonial power in trying to hamper the access to humanitarian assistance? This is the most important part. And as you know, our commitment to this issue, it has to be ensured that all help, necessary help, could also be accessible to those that are in need. Luckily, if I may use that word, that there is only 14 cases as compared to other parts of the world, and hopefully we can keep it at that level, and hopefully they would recuperate. Once again, in this case of the COVID-19, is there any influx of additional assistance or additional resources that are needed, and what particular help that are of imminent that has to be forwarded there? And last point, rest assured of our wholeheartedly support for UNRWA and of course for the Palestinian cause, and whatever we can help. We have a hospital in Gaza, as you know, and we are also creating an Indonesian cardiac center in Gaza. But that was the plan for past before we had COVID. So now I don't know whether we could. We have to also take into account the immediate urgency of the COVID as opposed to other issues. And of course, once again, earlier this year, we have the signing of the MOU to develop an Indonesian hospital in Hebron, as well as capacity program, building program for Palestinian. And we look forward to the projects that we are going to have on building of the school, the girls' school in the occupied territories Once again, of course, working closely with UNRWA, and we hope that all this project could be concretized as soon as possible. So I think I leave it at that. I'm not going to take the floor too long. Sheikh, once again, Chairman, thank you very much for this VTR. I do apologize if I have to run here and there because I have 2 other VTC on the Security Council also, but Palestine issue is for Indonesia is the most important issues also. So once again, but my deputy will be here, Koba, but I will be following you, although my face it will not be in the screen. So I'm using 3 gadgets at the same time. Thank you.
Yes, Ambassador Jani, we understand your time constraints and we appreciate for coming for all those reasons. I can give the floor right now back to Director Schmale to respond to all those questions asked by Ambassador Jani. Director.
Yeah, thank you very much, Ambassador Jani. Very much appreciated the support, the long-standing support of your country, Indonesia. That is hugely appreciated by UNRWA and all its staff and my leadership. Thank you. Your investment also into what is referred to as the Indonesian hospital here in Gaza is a crucial one. All capacities will be needed or are already needed in the fight against Corona. Now, you asked 2 specific questions. One is how much is UNRWA ready? Well, there's a couple of measures that we've taken to try and be ready for a possible outbreak, and that basically applies also in the West Bank. The first thing to say is we're guided by the PA's emergency plan. You know, we think it's important that whatever the UN, including UNRWA, does is aligned with what the government sees as priorities. This is a public health crisis, so it is the government that is leading this. It's not the UN, and we are supportive. That's the starting point. What we're looking at is how can we complement the work around quarantines. That looks slightly different here in Gaza than in the West Bank. In the West Bank, my colleagues there are thinking about UNRWA installations as quarantine centers. I think the PA has asked them to do so. Here in Gaza, we've agreed with all concerns that it will be the local authorities running the quarantine centers. We've made an ask through our own UNRWA appeal to support them with healthcare materials. So PPE, protective equipment is vital, basic medicine is vital. I've mentioned we think it's important that the population, that we contribute to behavioral change around this, as difficult as it is. And one thing that you will know, UNRWA's staff, there's almost 13,000, 97% of them are Palestinians. They are from the communities that we're serving. They speak the language, they know the customs. And so one important thing is to translate global messages around COVID-19 into local context. So when there are warnings about social distancing, of course, we have to ask ourselves, what does that mean to a refugee sharing a 2-bedroom shelter with 12 other people? Can you really live in social isolation? I think also on the global scale, the dialogue has moved on the narrative. Social isolation doesn't necessarily mean you cut yourself off as an individual from everyone else. So what we're trying to get, even in the crowded camps, across as a message is protect, identify who are those closest to you, for most of us family, and protect them. Stay at home with your family. Because if the family, even if it's 12 of an overcrowded shelter, doesn't get the infection, you will be safe if you take all the necessary precaution measures. And because it's clear that Gaza's health system will not cope, the best chance we have to fight the virus, even if it were to break out, is these kinds of containment measures. The public health messages about protecting your closest people, your family, and taking all the necessary hygiene measures will not be out of the window. That will be crucial as well. And then finally, also with Ramadan coming up, what is critical is food. We provide food to over 1 million people here in Gaza. And so we see it as vital that our food operation, our normal emergency operation, continues. And another important element is psychosocial support. We have many psychosocial counselors trained up, and we need the resources to keep them employed, because of course with people staying at home, with children being at home, parents at home, psychological needs are growing. We, like everywhere else in the world, calls into hotlines about gender-based violence are increasing. So that's an important element that we should not forget. And because of our reach, UNRWA can make a contribution there. Finally, your second question was the relation with the occupying power. I have to say, in terms of the military and security apparatus, I will mirror a bit what you may have heard from Nikolai Mladenov, who has said the cooperation between the PA and Israel at technical levels is working okay at the moment. I think that's true for Gaza also in terms of bringing in materials, etc. I have not seen I've not been given any reports that they have blocked any urgently needed materials that need to get in. The big worry, I have to say, is twofold. Number one, if there was an outbreak, there have been some indications that they will close Gaza off like a cruise ship. And that would be a mistake. If you tighten the blockade even more in such a crisis, it will have the opposite effect. It will make things even collapse more, and it will raise the anger and thus also become a threat for the occupying power. So our plea is do the opposite. You know, keep the borders open, allow people to come and work so that they can earn their own money for food, etc. And the other thing is military escalation. You know, we've heard statements also on the Israeli side that link any humanitarian support to conditions they know the authorities here cannot meet. And so our plea to the occupying power is hear the call of the Secretary General, let weapons stay silent, especially in this period, because that will make things even more worse. We will not fight this common enemy effectively if you let weapons speak. So I hope, Ambassador Jani, I've answered your questions.
Thank you, Director Schmale. And we have some colleagues who want to take the floor. We have Ambassador Anna Sylvia, we have Ambassador Adel Aras, and also Julia from Namibia want to ask a question, and then Ambassador Riyad. So I'll give the floor first to Ambassador Anna. Anna, you have the floor.
You are still muted.
Okay, before Anna gets ready for
Sorry about that. We have to
Anna,
get a costume.
Are you on?
You hear me now?
Okay.
Yes.
Yes,
yeah.
Go ahead.
Yes, I apologize to arriving late. I have some technical problem today. Yesterday was everything okay. Today I have some technical problem, so I missed most of the Mr. Schmale intervention. I would like to start my intervention also to express from the Cuban government our solidarity with the Palestinian people that today they are not only suffering the occupation, but they are fighting the COVID-19. So the question that we would like to pose to Mr. Schmale is regarding what member state can do both to help Gaza survive the crisis as well as to support UNRWA. And I'm not talking about financial. We know that financially this is the best contribution, but also sometimes some members they have problems to contribute with money, but we can work it out in other ways to help. And the other question is, are there alternatives to UNRWA is doing in Gaza? What would be your view as director of Gaza after working here for almost 2.5 years?
Thank you, Ambassador Anna Sylvia. Your questions are very important. Director Schmale, I think you can respond to those two questions before I move to the next one, please.
Yes, thank you very much, Ambassador Anna. Of course, the Cuban solidarity, like the one from Indonesia, is very well noted and hugely appreciated by both UNRWA staff and the refugee community and the larger Palestinian community alike. Thank you very much. Fully agree with you that our ask cannot just be financing. It is also financing, of course. And that's particularly an appeal to the traditional donor countries in these times where donor countries are preoccupied, understandably, with their own situation at home. We hope that this will not lead to a decrease in international funding, including for UNRWA and Palestine. Now, you know, one thing that came to mind when you asked what can be done beyond money, there's two things. One is technical expertise. Cuban doctors have a legendary reputation around the world. And I know that the authorities here, the medical teams here are very hungry for knowledge exchange. around how do we fight this, given our constraints. And I know a few days ago there was an exchange between medical staff from here, in UNRWA included, but not just UNRWA, and Italian medical staff to share experiences. So if there are ways of sharing experience and relevant knowledge and technical expertise, that would be very welcome, I'm sure. And we could, in UNRWA and as UN system, help facilitate. And the other bit is solidarity, what you started with. You know, I think in these times, the messages from the WHO Director General and the Secretary General and others are right. It is about solidarity. That is needed more than ever. And it links to the question of Ambassador Gianni in terms of the occupying power. You know, this is where we need to continue the solidarity with the Palestinian people. That will help also, and their resolve to battle this invisible enemy. And sometimes, so I'm grateful for your question, because it really is not just about money. It is also about the maybe somewhat intangible solidarity, but I know for Gaza's people here after 2.5 years, that means a lot when they hear international expressions of solidarity. Your second question, is there an alternative to UNRWA? In terms of the core services that we provide, so the 276 schools for 282,000 children, in terms of the 22 health centers delivering 1 million public health consultations every quarter, in terms of our social workers supporting the most vulnerable, and in terms of the food operation to over 1 million people, I see no alternative. There are certainly no other UN agencies on the ground that have the operational capacity to take this over. It's an illusion for people to think there is a delivery alternative to UNRWA. That's one side of this. And then, of course, there is the mandate issue. The reason we exist is not in the first instance to address humanitarian needs. You know, you could argue, why doesn't the World Food Programme run the food operation? We exist because there is no just solution for the people of Palestine. And there's also no alternative in those terms. The worry I hear a lot from refugees and others here is, if UNRWA hands over responsibility, does it mean the end of the refugee issue without a solution? And I think that's a question that needs to be heard very loudly and clearly. There is also, in political terms, in terms of the need for a just solution, no alternative to UNRWA until there is such a just solution. Thank you, Ambassador Anna.
Thank you very much, Director Schmale. I'm glad to see that Gianni is still there, sitting and waiting. That's wonderful. I give the floor to Ambassador Adel Raz of Afghanistan. You have the floor.
Thank you, Mr. Chair, for arranging and organizing today's meeting, and thanks to Director Schmale for your very informative briefing. First of all, I would like to highlight and underline the non-stop and very historical support of the government of Afghanistan, the people of Afghanistan, to the people of Palestine. I think a message to them that we stand with them, we feel them, and we know what hardship truly means, and especially in these very difficult times. I think my question is, in terms of your work, Mr. Director, I think you carry even more tremendous challenges today with what exists globally and very specifically in your work area, and then in Gaza. I think for countries who are fully developed, it's an unpredictable, severe problem that many developed countries are facing today. So, in terms of the approach you have put together, especially in terms of budget as well, you mentioned that there is need for essential emergency packages, and then, if I understand, that includes both health as well as food. You did mention, and I think, knowing that the COVID-19 does bring a very severe economic impact, and for how long do you see that your existing funding would be able to help you out? Because the predictability as of now, we think it probably would be a very long time until we come back to normality, where economies will pick up. So I wanted to ask you, and then I think something for us to think even more critically, and then if we do need to reach out and find the right way on how we can help you. And then lastly, again, I think as my colleague Anna said, with countries like us, the financial support probably might be a constraint, but I think the support that we can provide in terms of solidarity, we're always there. And then we hope we overcome this very difficult challenge. Thank you.
Dr. Schmale.
Thank you, Ambassador Delaras from Afghanistan. Allow me first of all to recall that in 2018, when we lost overnight the American funding, your government stepped in with $1 million. And I can assure you everyone in Gaza remembers that, because no one expected a country that's perceived as poor and having lots of problems of its own to step up with $1 million. You know, that counted as much as $60 million from other countries. So your solidarity has been very real here, both in political terms as well as in financial terms. You also, secondly, reminded me, I should have talked earlier indeed about the economic impact. The challenge in Gaza, of course, that because of the blockade, long years of blockade, the economy has been collapsing before the corona hit. We have unemployment rates here of 50%. And young people below the age of 30, it's 70%, women almost 80%. And the economists that know the situation here are predicting that already you're beginning to see the impact of rising unemployment. The prediction is it will rise to at least 70%, which is a disaster. So if we are lucky enough to prevent a local outbreak and get spared that crisis, again, we're hoping for the best, preparing for the worst, then for sure what will stay with us for quite some time is the economic impact in form of unemployment. And what can be done about that is your international solidarity, including pressure on the occupying power to lift the blockade. The economy is collapsing because of the blockade. That's the main reason. And if you want to help Gaza and its people back on its feet, one critical measure has to be lifting the blockade, allowing people the freedom to move and to find work where they seem fit. So that's, you know, part of the solidarity is there. Now, you asked how long will UNRWA's resources last? So we have almost 13,000 staff in Gaza and 30,000 overall for UNRWA. Right now, our core funding will last us till the end of May, as it stands, maybe into June, but then it's over. We have no funding guaranteed beyond that. And that would mean, in the case of Gaza, 13,000 people and their families without an income. So that would make a significant impact on the unemployment rates, and our services would potentially have to stop, our education, our health work, etc. So that's why, thank you for asking the question again. We are saying don't just focus on the corona. If you want to avoid Gaza collapsing totally, you need to maintain UNRWA's core capacities. You know, there's no point giving us money to fight the corona if you then cut the funding for the salaries of our health workers. That the two go hand in hand. So it is really about that. It's about the appeal for corona. We'll put out a revised appeal where we'll be asking for about $12 million for Gaza-specific measures as outlined earlier. We have our program budget, and then we have the emergency appeal that is mainly about the food operation. Thank you again.
Thank you, Director Schmale. I give now the floor to our colleague from Namibia. This is Julia Imene Chanduru. You have the floor, ma'am.
Thank you very much, Ambassador Niang, and thank you, the Director, Mr. Schmale. My question was actually now taken up by Ambassador Ras, but I would follow up with this. You have mentioned that you have made some appeal to the international community. Have you had any positive response, or have you had any responses so far? I know that it's difficult for each and every member state around there because of the unprecedented effect of COVID-19. The other issue also is on education. We know that e-learning comes with its own capabilities and challenges. You have mentioned that you have 90% of the teachers have telephone numbers of the students and their parents. What about the other 10? What are we doing to make sure that we reach all the students? Because it's no use to reach a certain number and leave out the others. So we need to look at ways to make sure that each and every learner has access to education. It's a difficult time, but if we need to make provision, we have to make sure that each and every learner is affected and no one is left out. I also want to express Namibia's solidarity with the Palestinians and also our full support to UNRWA and the work that you are doing. Thank you very much.
Thank you, Julia. Mr. Schmale, have the floor.
Thank you, Ambassador Julia. Again, the solidarity of your country is highly appreciated, and I think what the Palestinians that I talk about with here appreciate is that you've had your own struggle against the colonizer and you've overcome apartheid, and that I think is an inspiration for many here in itself. Now, on your specific question, have we had any response to the appeals? We are both part of the OPT appeal facilitated by humanitarian coordinator Jamie McGoldrick, and the response rate there has overall, for the first round of appeal, the immediate appeal, been relatively positive. I believe it's about 80% or so funded, and UNRWA is part of that, so we will get some part of that appeal because we've tried to really very closely align with the rest of the UN family. UNRWA's own appeal, which covers all 5 fields of operations, so not just the OPT, is also reasonably well funded in its first iteration. As I mentioned earlier, we are revising it right now. Our main worry, frankly, is the next couple of weeks. It seems that the initial response is positive. The more the longer term consequences become clear, and that's about unemployment and these kinds of measures, the more challenging we think it will become to mobilize resources, because that will be on a much larger scale than what's happened so far. And of course, in terms of the medical response, the hospitals, etc., that is also quite expensive. There's a global shortage in terms of protective materials, in terms of ventilators, etc. So it's not just a question of resources, but also a question of availability. But to repeat, in terms of funding, our main worry is more medium term, once the more dramatic consequences, and in particular in humanitarian economic terms, become clear. Your point very well taken about the online learning, and that's why our fantastic education staff keep telling me it's not just about the internet. To start with, not everyone has a smartphone or a tablet and can download stuff. Now, of course, many parents who do have access, they help each other out and they let neighboring parents come and download materials and so on. So there's a lot of solidarity that way. And then I think a critical factor in this is the teachers. Of course, there'll be limits while there are curfew restrictions and lockdowns in place. But at the end of the day, the key to reaching everyone is the people, is the teachers. And I know from some of them, they are really innovative to try and make sure that indeed no one gets left behind. So that's a clear message and a reminder to me. I will pass that on to my colleagues, that we really should not just celebrate the 90% that we can reach, but the 10%, pay attention to the 10% that need to still be reached. Thank you for that.
Thank you, Director Schmale. We have 60 minutes to go, and we have questions which will be posed by the audience. But before we get there, we can now give the floor to Minister Riyad Mansour, who is the Ambassador of Palestine to the UN. Minister Riyad, you have the floor.
Thank you very much, Mr. Chairman. And I want to thank you for organizing this very important meeting, and all of my colleagues. And I'm so happy to see all of you looking well and safe. Stay that way. And also I want to thank the effort of the division for all the technical support and making it possible. It is, Elio and his team. Thank you very much. And it is so good to see my good friend Matthias with us from Gaza. I still remember the moments when I visited with the SG, one of your schools, and met with your staff and with your students. It was a moving experience, not only for the SG, but for me as well. I will never forget those moments and those brilliant kids who engaged the SG and myself in a very mature discussion. And you are doing a great job in helping those generations to become future leaders of the state of Palestine. I want to thank you for your comments and the briefing that you shared with us. We know that UNRWA, whether it is its operation in the Gaza Strip or in the rest of the occupied Palestinian territory or in the refugee camps in Jordan, Syria, and Lebanon, are doing a remarkable job for millions of Palestinians. And it goes without saying that we always with you in urging the international community to provide you with all what you need in all fields to be able to continue with your noble and humanitarian efforts and help to the Palestine refugees until we find a just solution to this conflict on the basis of relevant UN resolutions. And your mandate from the General Assembly is what guide your work and what it helps us to continue, supporting you by renewing this mandate as we did just not too long ago for 3 more years until we find a just solution to this conflict. The so-called, exaggerated coordination between us and the occupying authorities, it is only limited to technical coordination. If there is humanity on this issue, they would lift, as you said, the blockade against our people in the Gaza Strip. If there is humanity in this endeavor, they would release the thousands of our prisoners, including children, women, sick people, and the elderly, so that we can take care of them. If there is humanity there, they would not allow our economic situation to descend into loss of 60 to 70% of our revenues that would put us in a situation to have an emergency plans in place, concentrating on the fundamentals and putting aside other things that we should provide for our people. So this is the reality that we face, especially for my brother, Johnny. He is a member of the Security Council, and he faces all these details as it relates to the Palestinian people, and we should not be misled by some of the technical coordination, not cooperation. It is not properly used. It is coordination because they are forced, to deal with us. They are occupying us, and they're controlling everything that comes to the occupied Palestinian territory. I want to ask you if you can comment on 2 questions. One, the Secretary General, announced, and we support him in that announcement, that he said that we need $2 billion for the most vulnerable among us, especially in the South, especially, the refugees, especially those who are the least developed countries, Africa, and of course, people who live under occupation. This $2 billion, which I assume it covers everyone, including UNRWA. Are there, some concrete material that we have some funding in that $2 billion fund? And the second question is related to the unemployment and the economic situation. This devastation has a global effect. And it means, as the Secretary General said correctly, on the basis of solidarity, we need in the South about 10% of our GDPs in order to cope with the economic and social devastation, and to do it on the basis of solidarity, so that no country and no one to be left behind. Now, are we seeing some serious progress in that direction, including, of course, the very courageous message that the SG sent to the G20, with the message that on the basis of solidarity and helping each other within the house that represent all of us, which is the UN. Do we see some progress there, including filtering down through UNRWA? And I totally agree, and I think my colleagues do also agree, that the best system and organization that has a tremendous record of delivering services in all fields is the United Nations and its agencies. We do not need to reinvent the wheel. The UN has been in business for more than 70-some years, and it has a fabulous record in delivering to the needy people and delivering in the economic front. Now, do we see also progress in that field? Maybe it is not you that we should address these questions to, maybe to the SG, to the UNDP, to the World Bank, to Amina Mohammed and others. But since we are talking about humanitarian situation, if you care to dwell with us on these issues, I really appreciate it. But Gaza is remarkable, and it always has been doing a remarkable thing, and I am so proud of our people in Gaza, and also thankful to UNRWA. UNRWA, you are a giant in Gaza, and you are doing a remarkable job for those 200 people, and we thank you. Thank you, Mr.
Thank you, Ambassador.
Thank you, Minister Mansour. Director Schmale, can you respond something like this?
You were broken. I think
you respond in 4 minutes, please, because we have time constraints.
Yes, okay, I'll try and be.
Yes, you have the floor.
Thank you very much, Ambassador. And Ambassador Mansour, Riyad Mansour, your visit here is very well remembered by many people, and your eloquent defense and representation of your people in New York with your team is also very highly appreciated. Very quickly on your two specific questions. To the best of my knowledge, the 2 billion appeal, there's some response, but the last I heard it was below 500 million. So, you know, not a fourth yet. Now, it is still early days, but there are some worries that, as I mentioned earlier, because this is a global crisis, and many of our traditional UN donors are preoccupied with their situation at home. There's some reports here and there of resources being diverted from international aid into fighting the corona at home, and that's a bit of a worry. But so it's not altogether bad news, but the momentum is not quite yet what it needs to be if the ambitious goal of 2 billion should be reached. So hopefully, and I know the SG is doing his best to remind donor countries of this need. In terms of unemployment and seeing, in a sense, you know, the SDG agenda of leaving no one behind being implemented also here. So far, I have to say, we see relatively little of that. And I would maintain for Gaza, the main issue is not necessarily international aid. This is a highly educated population here in Gaza, as you know, not least because of our UNRWA education system. But I remember, as a small anecdote to close my remarks on this, when in my first week here, a senior Palestinian advisor said, you know, the old saying that you shouldn't give people fish, you need to teach them how to fish. He said, in Gaza, we know how to fish. We don't need to be taught how to fish. We need the opportunity to fish. And I think for me, the corona has not changed that. The Gaza's people are innovative, are resilient, are entrepreneurial. If they get the opportunity by lifting the blockade and addressing the occupation, this will not be a poor place. Back to you, Ambassador.
Thank you, Director Schmale. I would like to thank you and for your time, for the very precise presentation you made, and the answers you delivered to the committee. And I wish that you and the people of Palestine the best in these very challenging times. Faithful to its mandate, the committee will continue working for the realization of the rights of the Palestinian people. I would like to thank also our colleagues for the very engaged participation to this event. And I would like also to thank viewers around the world who have been following our conversation. And I just wanted to also thank very particularly the Division of Palestinian Rights for the very excellent job they did, and Director Elio Tamburi and his team. And a final reminder that the recording of this event will be posted on the website of the committee, on the website also of www.un.org/UNISPAL, and the committee's social media streams on Facebook and YouTube. Please check our website also for future events of our committee. And I would like to say goodbye to you all and thank you very much for your participation. Be well and stay safe.
Thank you very
Bye-bye.
much, Ambassador Sheikh Nyang. Thank you for the work. Thank you.
Thank you to everyone.
Bye.
Bye.